Can everybody see that?
Yep.
Awesome. Okay, wonderful. Yeah, thanks so much for having me. I really appreciate it. I wish you could be there in person. Of course, but virtual certainly very convenient. So I am Dr. Shadia Rafage, and we're going to talk about telehealth today. A little bit about me. I went to Cornell University, graduated in '06, did my rotating internship, then two surgery internships, followed by a surgery residency. So I'm a board certified small animal surgeon. From there, I had various jobs across the country and finally opened up vet triage the end of 2019 into 2020, and of course then pandemic hit. So now I work exclusively with vet triage, and I'm rarely in brick and mortar anymore. So it's a fantastic change of pace. So we'll go over a long list of items here, talking about telehealth. It's a very complex topic, and the goal here is to just sort of clear up some of the confusion that might be out there, some of the fears of it, so you sort of know the facts. And it's impossible not to talk about vet triage, but I promise you this will not be a sales pitch for vet triage. This is purely to give you information on telehealth because we do need more exposure on it. The concept came to me during my surgery internship. I had always seen in the veterinary field that we told pet owners over the phone, if you're concerned, come in. And that's, of course, the front desk doing that because they're not medically trained. And people call and they say, do I have to come in or not? How worried should I be? So our answer was always the same. If you're worried, come in. Well, when you have that sort of mentality combined with the cultural toxicity in the workplace, high turnovers, the compassion fatigue, all that stuff that we're going to talk about later, and you combine that with a pandemic, a rise in adoptions, a shortage of veterinarians, you end up with a disaster from there. And that's where we find ourselves since the pandemic in the veterinary space. This has been an issue that's been creeping up over my almost 17, 18 years as a veterinarian, but the pandemic certainly accelerated the process. So we're seeing the struggles now, and virtual care is certainly a very powerful solution to the challenges we're facing in the veterinary space. So we base our platform, telehealth in general, on the AVMA definitions of these words. And so this is the website, the link, if you want to go, it's just on their website, and this is the drawing that they have, a picture. We're not going to go over every single definition or every category of telehealth, but it's important to, at least in your mind, have the structural framework of telehealth right there. So telehealth is the overarching term that we use for anything virtual, and that's the overarching term. And so underneath telehealth, there are subcategories. There's teleconsulting, telediagnostics, teletriage, teleadvice, telemedicine, all different types of teles. And so our focus has always been on teletriage and teleadvice because I knew from both an ethical standpoint as well as a legal standpoint, teletriage and teleadvice, that's okay. We'll talk about why. So teletriage is, do you have an emergency or not? And teleadvice is, let me give you some advice about your pet's situation. That's the idea. This picture is just an example of Cornell University uses us, and so just we create flyers for them to hand out to their clients. So it's kind of, it describes the platform and has a QR code there and the steps to connect. So then when you look at telehealth, again, that's the overarching term. Regardless of what your goal is of telehealth, whether it's telemedicine, which is usually in a brick and mortar setting, so associated with a hospital or a clinic, or whether you're talking about teletriage and teleadvice, like my platform, these are different categories for telehealth platforms. You can consider whether or not it's going to be a software. Is it going to be video or non-video? Are you going to have it associated with a brick and mortar, or will it be outside of a brick and mortar? Are you going to have asynchronous or synchronous? So asynchronous, for example, is a communication modem that's delayed. Texting is a good example. Emailing. You send out an inquiry and you'll get a response sometime later. Synchronous is real time. So of course, real live video is real time. An actual phone call is real time. That's actually happening in the moment. Are you going to have veterinarians or technicians? Are you going to have GPs or specialists? What type of telehealth are you going to provide? Triage, advice, consulting, diagnostics, what species, who's your market audience, and how are you going to have hours of operation? This is the overarching landscape of telehealth when you look at different platforms that are out there, just so you're aware of it. Vet triage is not the only way to operate telehealth. There's various modalities depending on what you're looking for. HIPAA compliance is not a phrase that we throw around often in the veterinary field. It's very common on the human side. It has to do with confidentiality and cybersecurity measures, and vet triage is HIPAA compliant. The reason why I believe this is important, or at least will be important, is because as this field continues to evolve, we're going to see requirements like this, I believe, become mandated. It's not there yet. In fact, we're not even required to have medical records if you're not associated with a brick and mortar facility. So we are far behind what telehealth probably ought to be. But HIPAA compliance is something that I think will be important in the future. The big question probably in everybody's mind is the VCPR, the veterinary client-patient relationship. And I'm sure a lot of you who have any exposure to telehealth have received skepticism with it because of VCPR. So what the VCPR is, it's a relationship that's established in person when the veterinarian meets the client and the pet. That relationship, that physical in-person interaction, is the acknowledgement that the doctor has the ability and the skill set, the access to that patient's medical records, diagnostics, the patient itself, and then the client has agreed to also follow what the veterinarian is saying. The agreement, the relationship also assumes that there will be ample follow-up in terms on the veterinarian side. They'll have access to care, and then what does the client have in terms of emergency care? If that veterinarian is not available, what does that relationship allow for? Because if the veterinarian is not available, then there has to be some kind of emergency aftercare. So that's what the VCPR is, and so that's the reason why it's very important. It's the first interaction between veterinarian, client, and the patient. This link here is a map from the VVCA, an organization that's one of the organizations that are spearheading the movement with virtual care, and it goes through which states in the U.S. are okay with a virtual VCPR, require only in-person VCPR, don't allow any virtual care, etc. The reason why we consider the VCPR so priceless is because our patients can't speak for themselves and the client has to interpret the clinical signs. So they truly try to stress that a VCPR can't be established electronically and it has to be done in person. And so although I don't agree with all the aspects of the VCPR requirement, you can see its importance, and this is the reason why the AVMA stresses it, is they're looking out for the health and well-being, the safety of not only the pet, but also for the client as well, to make sure that there's no ill will if any veterinarians are looking to be a bit shady in their operations. So with an emergency situation, which is what teletriage is, of course that's the world that I live in, you take into account the patient's current health status and then what prompted that pet owner to have to access the virtual platform in the event of an emergency. So what some states have come up with is the concept of guardrails. And guardrails are a handful of stipulations that will allow a platform like Vet Triage to extend beyond what has conventionally been considered okay in the virtual space. So these are the stipulations that we have here, and for the most part, I do agree with these. There has to be some level of privacy, of course, because this is a cybersecurity issue, so you need to have some level of privacy. The judgment call of whether or not that telehealth platform is adequate enough for that pet in the moment or ongoing is at the judgment of the veterinarian, right? So a veterinarian wouldn't assume that they can provide vaccines or surgery over virtual care. So the veterinarian decides, is this an appropriate medium? The person who is accessing virtual care for their pet is given the choice. They're not forced to. So they have the option of accessing virtual care. It ought to be synchronous, so real time, and video. And it has to be written consent from the pet owner that they understand the limitations of telehealth and all that good stuff. You still have standards of care. There still has to be some kind of follow-up, and prescribing depends on how you want to protect the consumer and the veterinarian from prescriptions. So this is a pretty cool start. This is a great way, I believe, of trying to figure out a way to extend virtual care because we need it, consumers want it, but without getting too crazy, without assuming you can do too much as a veterinarian. So with Vet Triage, we were the first platform doing this. We're the largest platform in existence. We're approaching 100,000 sessions. We're in over 20 countries have used us, almost 40 different animal types. I've got 60 plus staff. It fluctuates depending on their lives. I have a handful of support staff, mostly licensed veterinary technicians. We're 24/7, hundreds of partners across the world. We have a Spanish-speaking platform, an equine-specific platform as well, and of course, we have publications. We have one publication that we'll go over later, and several en route. So it's impossible, I think, to talk about telehealth without talking about the current crisis in the veterinary field. And this part of the talk is going to be a bit of a downer, but I'm sure none of you are strangers to this, unfortunately. But it is the way it is. It is where we're at now, but it can be remedied. So when you look at the shortage of veterinarians, which again, if you haven't heard about this before, this is what's been happening out in the field. I call it a relative shortage. And the reason why I say it's relative is because we have the largest number of veterinary schools in our history. When I applied to vet school, there were barely 30. There's way more now. Class size has also gone up. The applications have increased year after year to veterinary school. So if the veterinary field is growing by this amount and vet triage is receiving a large number of applications for work, well, then where is the shortage? And that's why I believe it's a relative shortage, not an absolute one. I believe veterinarians are graduating school, they get their first job, they're like, this is awful, I'm out of here, and they leave. And I'm not sure I have any other explanation other than veterinarians are exiting the field at a larger rate than we can replace them. That's where the shortage comes into play. We're all familiar with suicide rates. Obviously, the rate ought to be zero. We have, even compared to the general public, we have way too high of a suicide rate in the field. Veterinarians are 2.7 times more likely to attempt suicide. 7.5% of vets have thought about committing suicide. And this is tied to an unhealthy psychological status. That status is based on like a questionnaire. And in 2019, 6.4% of vets had an unhealthy psychological status. It went up to almost 10% 2 years later. This is unacceptable. And of course, this is multifactorial. I'm sure everybody here is familiar with this. Staff turnover is a problem. We have the highest percentage of turnover when you compare to the hospitality industry in general. 23% turnover versus 12 to 15%. Burnout rate is crazy high. This is all due to mental health, like we spoke about earlier. Debt and staff shortages are all factors that contribute to staff turnover. They go to their job and they just don't feel happy being there. And especially if you look at the new graduates, they have a real challenge with work-life balance. They don't enjoy the work that they're doing as veterinarians. They just don't find it enjoyable. They find the workspace to not be invigorating for them. They have conflicts at work with colleagues, student debt, low income, cyberbullying. So all this stuff, again, not to be too much of a downer, but it's all playing a role as to why virtual care especially has exploded. I had recognized this back in 2007. I knew this was going to be inevitable. Just nobody would have predicted it would have happened so quickly at such a profound rate to the point where we'd be in a crisis. So when you look at barriers of telehealth, really the biggest barrier are veterinarians, honestly, even beyond the laws and guidelines, because we're so slow to change as veterinarians. And, that's how we are. We're consistently behind the human side of medicine. A lack of veterinary exposure to telehealth with veterinary students is a problem. 92% of students heard of telemedicine from the internet and social media platforms. It really ought to be, ideally before vet school, that you hear about telehealth, but during vet school is really where there should be some time allocated to it. But of course, you've got a lot to learn, only a few years to do it, so it has to be made a priority. And by the way, the word telemedicine here, let's just talk about that for 1 second. So you're going to hear and read about folks using the word telehealth and telemedicine synonymously, interchangeably, and they're not. We already know that telehealth is the overarching term and telemedicine is one subcategory. Telemedicine, which is not teletriage and teleadvice, telemedicine is where you perform virtual care in association with a brick and mortar because you have that in-person VCPR set up. The veterinary client-patient relationship has been established already, and that is telemedicine. You're providing virtual care after the VCPR has been set up in a brick and mortar facility. That's telemedicine. Unfortunately, a lot of our laws and guidelines will use the word telemedicine to either mean telemedicine or to mean telehealth in general. And that's inappropriate to use the terms interchangeably. They're not the same terms. All telemedicine is telehealth, but not all telehealth is going to be telemedicine. So keep that in mind when you read this stuff, because it just shows a lack of exposure in the veterinary field, even with the folks who are making the rules. So as students go through vet school, their telemedicine knowledge increases, but we want to have more exposure to it. The concept of the misconception of misdiagnosis has been shown on the human side to not be that big of a problem, and on our platform as well. When you talk about emergency versus non-emergency, we're pretty up there. I'm hoping to write a paper on that. We'll see if we can get the data for it. But anyway, on the human side, it doesn't seem like there is a big problem with doctors misdiagnosing people's conditions over video, and it seems like the patients are typically satisfied or very satisfied with their experience. So that's good. Now, if you look on here too, a lot of this is follow-up care, right? So not the initial consultation, but the follow-up, post-operatively or whatever, which we're all probably familiar with. I've used my own doctor for virtual care, so it comes in handy. On the veterinary side of things, the concern for lack of client adaptation to the modality is unfounded. We all know this. We all have phones in our hands, right? Everybody's video chatting all the time. So why wouldn't a pet owner automatically assume, yeah, I want to talk to a veterinarian on video? Why wouldn't I? So clients are not have no challenges with the concept of speaking to a doctor virtually. And so this is a study that looked at clients using virtual care as a follow-up after, I think, dog neuters, and the numbers there are positive. So we'll see more of this. Here are just some short snippets of other publications that are more recent. So looking at zoonotic disease is fantastic with virtual care. If you're able to figure out a scenario, let's say it's a herd population, and you want to see whether or not there's something infectious there, but you don't want to introduce people in there, and people will serve as a fomite, or potentially if it's zoonotic, they'll get infected. And so foodborne disease, food security, these are really good indications for telehealth, especially if you look at the One Health framework, where it unites people, animals, environment all together as a One Health. This is another study looking at pet owners using telehealth, and all of these numbers are fairly low. At least it's promising that studies are now being produced to try and raise awareness for telemedicine in terms of utility. So 12% of dog owners, 6% of cat owners have used telemedicine. 25% of owners who've never used it would be willing to use it again in the future. It's pretty cool. We're gonna see more of this stuff. This was a study looking at trying to compare physical exam versus a virtual examination using pigs, and they found that depending on what clinical parameter you're looking at, so a certain anatomic examination of the pig, these are pigs that had umbilical hernias, whether or not that specific physical exam finding was correlated with the video exam finding. And they found that depending on which part of the body you're talking about, what part of the hernia you're talking about, the correlation went from poor to almost perfect. So it's the gamut. And I like this because this tells you that there's an immense amount of variability with virtual care, of course, as you'd assume, and it should be the judgment of the veterinarian to figure it out. If I can't see clearly on a video what's going on with that pet, well, then I'm going to make sure to not overstep my boundaries and be like, well, I don't know if those gums are really that pale or not. So it's good. It's good that we're seeing this. Digital approaches were used by veterinarians, and the usage was enhanced by COVID-19. No one's surprised there. The lack of clear legal framework may be a significant barrier. Of course it is. Veterinarians don't want to do anything that's considered, forget even unethical, illegal. So we want to make sure we're doing this appropriately. This study showed that there is a reduced stress for owners and cats. They were seen as an advantage of telehealth. That's great. Lack of clinical examination, risk of misdiagnosis were viewed as disadvantages. Of course, we already went over that. 85% of owners and 67% of veterinary professionals felt practices should offer telemedicine. That's pretty good. Why not have it as an option? So we'll see. We'll see as things move forward. Our first paper with Vet Triage, I published it in December of 2023, looking at 15 novel species that were aided with the use of teletriage. So we had 15 different animal types that had never been reported before to have had telehealth, and we published it. It took about a year of work. These are all the species that we ended up publishing. It's a case series, and these are some pretty wild animals. But this is the beauty of virtual care: is you can take care of pets that usually are really hindered by stress, or that are borderline wildlife, you can't really bring to a veterinarian. Who's going to bring a squirrel to a veterinarian? What veterinarian is comfortable with squirrels? And so virtual care is great, or fish, for example. So it's pretty cool. There's just a collage of all the animal types. That pleco there on the bottom right, that fish, that's an interesting story. For those who don't know plecos, they're a sucker fish. They clean the algae, and while the wife was in a virtual call, the pleco had jumped out of the tank. The husband found it, presumed it to be dead, threw it in the trash, and his wife came out of the meeting like 6 hours later, and he told her, well, she noticed the trash bag was still moving, and so she found the fish, the pleco, still alive, put it back in the tank, and then immediately called us on video. And I was a doctor in all these sessions, and so she basically wanted to know what else to look out for, kind of like a post-resuscitation of a pleco at home. And the pleco still had they have a German Shepherd at home, had all this German Shepherd hair on it from the garbage, and the dog had been licking the fish by the time the husband found it. Anyway, so this pleco made it, and upon follow-up was doing very well. So crazy case. That in the middle there, you can see there's a sea otter. We had a baby sea otter that was trying to traverse Alaska, actually you guys, to get to a ship to then get brought to a wildlife rehab center. And so they were talking to us about how can we rehydrate this, where can we connect them to on the way to their travels, and so that was pretty cool. Lots of other examples here of novel species, so we published that, and we have more papers that we're currently working on. There'll be larger studies looking at actual factors that influence the teletriage doctor's decisions. This was just a quick case series to kind of give a taste of what we can do. I believe that veterinary telehealth sits amongst the pillars of veterinary medicine. It bridges the gap between GP, ER, rescue, and veterinary specialists. So we're integral to connecting the dots here. This is a video of an example on vet triage. I don't know if it's going to work here, so you guys let me know if you can hear it and see it, and if not, we can always bypass it. It's just an example session that I had. It's a nice one for triage.
Hello there.
Hi.
Hi. I'm Dr. Ray.
Can you guys hear it?
Nice to meet you. I'm Erin.
Hey, Erin. What do you have going on?
So I'm fostering. Well, they were 2 pregnant. One had her kittens on Friday. The other one. Let's see if I can turn my camera around.
There you go. Yep.
There you go. The other one, so she was fine, and then one of my main cats got under the door and stressed her out a little bit, and then right after that little tiff she had with the other mom cat, she started acting a little bit more weird, trying to go up to the mom cat, and then she was kept trying to go back to her, and she wants more attention now. She's purring pretty rapidly more. Very minimal discharge, so I don't know if she actually is going into labor, but she keeps trying to lay in the bed with the other cat and the kittens. So did maybe the stress just cause something, or is she in labor? Do I have anything to worry about?
Gotcha. Okay. All right, cool. How old is this one?
Honestly, I have no idea. We got them this is going to be this cat's 3rd litter.
Okay,
so,
that was my next question. How many litters this one had? Okay, so this is the 3rd litter. Very good. And do you know approximately when she, how long she's been pregnant for?
Probably around the same time. So, I really don't know. I got them when they were already pretty pregnant. So I've only had them for about 3 weeks now.
Okay.
She's not as poofed out as the other one was right before she gave birth, so maybe she's just a smaller litter, and her nipples are still.
Yeah.
There you go.
And then how many babies are in there? Has anyone taken X-rays?
No, this has completely been home stuff.
Gotcha.
I feel maybe 3, but sometimes it's hard to tell.
For sure. Let me look at her. Let me see. If you were to pick her up and then put her on the bed, can you do that and then watch what she does?
Yeah.
Okay. I want to see.
I know.
Aww, boo boo. Let me see what she's doing here. Is she on any medications or supplements?
No, she's not on anything. She's on kitten food and then wet food once in the morning, once at night. So she went back to her bed, but earlier she just kept trying to go back to this cat and her kittens right there. So
Gotcha.
now she seems to be going back to here. So now I'm thinking she's in labor, but she really doesn't have a lot of discharge.
Yeah.
She has some, but not a whole lot.
No, here's the thing. I agree with you. I mean, the nesting, the neediness. I think that's all. I think she is, if not in labor, going to be in labor tonight.
Okay.
This is fairly. So what I would actually think of doing, if you're okay with it, is just minimize stress in the room. Maybe dim the lights. Kind of give her own space. Let her do her thing. You know, watch her from a distance and see what she does. Have food and water available for her and see what she does.
Okay, and then I guess my next question is, so originally me and my sister were gonna like each take one of the cats. So if she does take this one, it would obviously have to be after she's had the kids, right? Because we don't want to stress her before she has them.
I think so. I think it's a smart idea. Whatever we can do to minimize stress in this cat's life, because
she's having contractions.
Yeah, there you go. Yeah, let her do her thing.
Okay, so then after she has the kittens, what's like a good time frame that she could be moved with them? I just don't want any stress for the other mom, and I don't want continued stress for her. They're okay for the most part, but
the easy answer is no one knows that, right? But I will tell you that as a board certified surgeon, having done plenty of C-sections, dogs and cats, I will say that the second the surgery is done, the mom's awake, the kittens are awake, the kittens are nursing, mom is good, I send them the hell home. Like, they go. So, and it's literally hours after surgery, hours after giving birth with a C-section. So I would say the second the kittens are out and they're nursing, mom is good, move them whenever you want.
Okay. All right.
Yeah.
Well, then I think that's it. I mean, she might just have a slower labor than the other one did, but.
Let's do this because it's still early in the night. I'm going to email you, and I'm just going to send you a blank email. I'm going to send you a blank email. That way, if you have any updates for me, if you want to send me pictures or videos and say, hey, doc, it's been 3 hours. Here's what's going on so far. What do you think? Or whatever. Or you may not need me, but let me at least send you a blank email, and that way you can at least have access to me beyond this video session, so we can make sure things are good with mom here.
Okay. All right. I appreciate that.
My pleasure, of course. But yeah, I think you're on the right track. I would say dim the lights, let her chill. Okay. And that's and I don't know if having the other mom and the kittens in the room is more stressful or more relaxing. It's kind of your judgment call.
Yeah, I mean, the only other option would be to have her give birth in my room away from the other cats that are in my house and then her, but then I'm not sure if that new environment would also make it just more stressful for her because there's a bunch of new smells. The other cats' smells are predominant there because they sleep with me.
Then, yeah, whatever is least new, I would say, is the way.
Okay, so just keep her in here and keep an eye on her.
Yep, that's fine. Just dim the lights a little bit and keep things kind of chill.
Okay, all right. Well, I appreciate your help.
Of course, my pleasure. I will send you a blank email here, and we'll get you, and just keep me updated if you want to. Yeah.
Okay, great. Thank you so much. You have a good night.
You too. Bye-bye.
Bye-bye.
So that's a nice example of a teletriage, teleadvice session that we could have sent her to the ER. She could have just showed up, but stressful for the mom, for the kittens. And then, a couple hours later, I get an email with pictures of mom and kittens nursing. So it went really well, and it's a great example for why this should not show up at the emergency hospital. There's no need. The emergency hospital doesn't want to see this type of case. They are dealing with really critical cases. This is not one of them, and so we're able to take care of them. So just to recap, the next few slides here before we finish up, these are my observations from what we've seen. I've listed for you previously the challenges that the veterinary field is facing currently. And so I wanted to give you at least my perspective with lots of cases, being the largest company, the only one doing it this way with video and veterinarians 24/7 to any species, what we've seen on the ground. We get information from the clinics that partner with us about how they're doing with all the stuff that they're struggling with. So in terms of staff shortages, they're seeing improved retention. This is all through partnership with Vet Triage. So when they're able to offload their cases to Vet Triage or give their clients another option, this is what they see on the ground. So they see improved retention, less turnover, easier hiring. The hiring thing is cool because some of them now are using the fact that they're partnered with Vet Triage to tell doctors who are going to be on call after hours, hey, we know you're going to be on call. However, with Vet Triage acting like an answering service, 80 to 90% of the calls you're never going to get. And so it helps with work-life balance, and it helps entice the newer graduates to be okay with a job that has on-call. And of course, Alaska is one of our biggest states for this because of how far apart things are and the disparity of access to emergency care. So a lot of doctors have to do their own on-call. Decreased suicide rates, although I don't have any data on exactly that. We do see an improvement with compassion fatigue on the floor, and when you have veterinary staff members that are less fatigued, patient care improves. And it helps not just with patient care, but also how the leadership team is viewed by the staff. It shows that they care about their mental health and work-life balance. And for newer graduates, you can customize basically how stressed out you are with your experience level. So if you're a new grad just starting your first overnight in a busy hospital, you may want to be like, all right, send everything to Vet Triage, and then anything that shows up from them, we assume are going to be really sick or injured or critical, and we'll take care of it. I'm a newer doctor. I need more time to work up these cases than a more seasoned veterinarian. Great. And then as you get more experience, you can handle a higher caseload. The barriers to telehealth we don't really see on with our platform on the ground. Once this is explained to them, what the definitions are and what's considered acceptable, what the limitations are, what the expectations are. Veterinarians are the biggest barrier to telehealth. We can change how these things progress. That's why I'm doing this with telehealth, just to spearhead a movement to show that we can do this safely, ethically, legally. And so you want to make sure you're up to standards, and that's why I only have veterinarians performing triage, only video, HIPAA compliance, all that good stuff. We're going to see more and more guidelines being updated. Just recently, both Arizona and California are now approving virtual VCPR, so that first physical interaction between doctor, client, and patient can now happen virtually, and that changes the landscape. And this is just the beginning of this stuff. And then through publications, talks like this, continuing education, more experience, more training, we're going to see this progress further to where it won't be such a feared topic. So that's the hopes with this. This is all my contact information. If anybody wants to reach me about anything, whether it be veterinary school or post-graduation or telehealth, I'm happy to address anything any questions or concerns anybody has regarding this. A lot of our YouTube channel is a lot of educational videos tailored towards pet owners, but actually can help young grads as well. And yeah, I welcome any questions, comments, ideas at this time. Thank you for your attention.
Right on.
I have a question. With giving clients your email address and kind of saying reach out anytime with any questions or concerns, how do you set boundaries with that?
Yeah.
Make sure you prioritize your personal life too.
Yeah, so when on Vet Triage, we have a Vet Triage inbox, and that inbox is monitored 24/7, usually by support staff. The doctor who saw the session is not necessarily the one who might answer that client's email later on. So a rule on the platform that I have is work-life balance. If the veterinarian who was on shift is no longer on shift and that client calls or emails with further questions, another doctor will deal with it. And that's because I don't want to call another doctor when they're off duty from the platform. It just doesn't make any sense. So even though in this scenario, in this case, I gave her my email, it's a generic email for the platform. Any veterinarian could have seen those pictures of those kittens and then commented or answered any questions they have. In the beginning, though, to answer your question more from a historic perspective, I was the only doctor on. And so I was doing this 24/7 on a global scale from the get-go. So you can imagine my work-life balance was in the toilet. However, I knew that going in. I sort of accepted that, and now I have a much more humane lifestyle. Still not great because I am the owner of this large company, but still much better than it was before. And so I create protocols to create work-life balance, because as a veterinarian, I know what I would like. And when I don't want to be bothered, so I just assume my veterinarians that I hire and train on board, they probably feel the same way that I do because I'm a veterinarian and they're veterinarians. So I created these rules to satisfy them, because I knew it would satisfy me as well. Otherwise, it wouldn't make any sense to make them do things that I myself am not willing to do. So that's how we handle the emails. Fortunately, because most of these conditions are acute, usually when the client has questions, they ask them pretty rapidly, and the doctor is still on anyway. We're usually not dealing with chronic long-term conditions. These are usually things like, my puppy began limping today, I came home and found diarrhea, I'm not sure if I double dosed his medication. Those are the things that we see. So we don't really get that many questions, but when we do, they typically are pretty soon after the session was completed.
And I would add that is a good question about email, because lots of practices have email, and that's always been a question in my head. Like, well, someone can tell me like the emergency that they need to be just straight on their way in, and I don't see it for 6 hours or 48 hours or a week because I'm on vacation. Or they're just upset because I didn't answer it and wasn't critical. So talking to your practices about how communications are handled in general. I like that concept of it being monitored.
Yeah, I mentioned the other slide, I have about half a dozen support staff, mostly LVTs. They're not giving medical advice. They're the ones actually who are monitoring these emails to let the doctors know when there's an email waiting for a response. And they also are the ones that are keeping the workflow going, making sure clients aren't waiting too long to talk to a doctor on video. They make sure to help with payment for people who don't have video, don't have internet. They can do this stuff over the phone too if they need to. So it's very important to have that sort of workflow. So I created a virtual call center basically for this exact purpose. Because yeah, you're right. We can't expect any veterinarian to be around 24/7, even though I was in the beginning. But in an ideal scenario, they can't be expected to be around. Plus, by the way, any follow-up the client needs on vet triage, they don't pay for that again. So basically the rule is until their family veterinarian is open again, we will take care of that pet. So if we see somebody on Friday night and their vet isn't open till Monday morning, they can ask us questions, call us if they want about their pet's condition through the whole weekend, and we'll take care of them without charging them again for the added doctor input. So we want to make sure that clients are taken care of, not just at the moment, because things can change. If all of a sudden a vomiting and diarrhea dog on Friday night turns into a bloat the next day, we need to know that so we can change the plan. So the owner just isn't sitting there at home with what once was a stable dog and now has a GDV. We want them to tell us that so we can call them in. And if they're relying on an on-call doctor to be called in, they need us to do that, so we need to expedite that. So
I have a question. As far as the vets who are working for vet triage, is it like a full-time, part-time? What do their hours look like? Things like that. So
1/3 of the doctors are in their retired, semi-retired state of their career. So those doctors are doing this full-time, like 40 to 80 hours a week. And that's on their own. They're choosing that. I'm not making them work those hours. That's what they want to do. So they work like 5 to 7 days a week. The other 2/3 of my doctors are usually on the younger side, although still experienced, and they have a primary gig in brick and mortar, and they do this kind of on the side. They devote a handful of hours a week or whatever they can do to the platform. They create their own schedule as well in the platform, so there's lots of versatility there. All the doctors are independent contractors, so the terms full-time and part-time don't really apply there because they're not technically speaking employees. They're independent contractors. So that way they have the freedom and flexibility to not meet any standards. And I have the freedom and flexibility to say, we need more commitment, less commitment with the platform. And then we can decide whether or not it's still working for them with expectations. But yeah, 1/3 do this full time, 2/3 are doing this part-time. Some do it temporarily. They'll do it like while they're touring Europe, or until they give birth to a child. Some have temporary physical disabilities and they can't be at the clinic standing up 12, 14 hours a day. And so they'll use this temporarily. I had a doctor who was doing this while he was studying for his residency in oncology. Why not? You're studying for 3 months, you're at home anyway, you can make some extra money and still stay active but study for your board. So different reasons why people join us.
Thank you.
Yeah, my pleasure. I do make sure that the doctors have ample experience. So they're usually several years out of school minimum, and a lot of them actually are decades out of school. And also they are ER doctors, or they've owned practices and sold practices. Some are specialists. So I do look for ample amount of experience, and you can imagine why. If you don't have these to help you with a physical exam and you can't rely on blood work and radiographs and everything else, I need someone who's seen a case numerous times to be comfortable saying that is not an emergency, that is. Here's what to look out for in case it's non-emergency turns into one. So there is certainly a place for doctors of different experience levels. I try to get ones who are a bit more seasoned to join the platform.
Good. All right.
Hi, Dr. Schneider. Thanks for your talk. So in the example you gave us with the kittens, say that escalated into an emergency situation, in your opinion, what would be the sequence of events to reach out to a hospital? Because like I worked at a hospital here and answered the phone and someone just started like spitting out like medical terms and I was like, wow, this owner is really proficient. And I was like, oh wait, it's like vet triage. And so yeah, what is the behind the scenes? How do they get to that?
So I since created a protocol for my staff where they have to introduce themselves as who they are and what their title is on the platform, and then start with what you think the diagnosis is or what the condition is what the concerned condition is. That way the person answering it is not blindsided by like a very knowledgeable owner. So that hopefully that gets rectified, so they know who's calling. Behind the scenes, it all depends on the veterinary practice that's partnering with us. So they create a customized protocol that describes to us on the platform what our emergency options are and how we can handle them. So some protocols say, here are the 3 emergency hospitals in the area. Good luck. Others are, here is the on-call schedule, here's the calendar, here are our fees, here are the doctor's cell phones, and we call them directly to an emergency to have them meet the client at the hospital. Then you have others that are large 24/7 multi-specialty ER hospitals that will give us a dedicated vet triage phone number in the back. So when that number rings, they know vet triage is calling. And that would have to wait on hold with the front desk who are really busy, and it'll slow things down. So the behind the scenes depends on what protocol we're following, depending on the partner clinic. But they all know that when vet triage calls, pick it up because we're calling in an emergency. Having said that, that case specifically, she, if I recall, was in upstate New York, and upstate New York has a large surface area, and there's only a few ERs, and they are stressed. So usually in that scenario, if we call one hospital and they're like, no, we can't do it, we're at capacity, then we're asking the pet owner, how far are you willing to drive? Because some of those places, as you guys are not strangers to, it's hours of driving to get to the ER. I mean, sometimes by the time you get to the ER, you might as well wait for your vet to open the next day. It's going to take so long just for the round trip. So we have to play this game with the pet owner of where are you willing to drive? Because if option number 1 declines our referral, we have other options, but they're farther away from you. What do you want to do? And then the rare scenario where, again, behind the scenes, we will manage cases that are insane because they have no option. We've managed blocked cats and GDVs, hemoabdomens for days at home. This is not the ideal. We're not promoting this. This is in scenarios where there is no option. The person lives on an island, they need a ferry or a plane to get to the nearest hospital, and that ferry or plane isn't even available till Sunday morning, and it's currently Friday night, and you've got a blocked cat. And now what do you do? And so my doctors we all figure out a way to manage that case as best we can until they can actually see a veterinarian in person. So that's how desperate the world is when it comes to vet care. When we talk about veterinary deserts, which are defined as isolated areas that do not contain any access to care, and we help with that. That's the importance of having doctors on video live. But anyway, behind the scenes is most of the time the normal situation is the protocols are there. We know our emergency options thanks to that partner clinic, and we just go down the line of what our options are based on our protocol to get that pet owner help.
Cool, thank you.
Yeah, no problem. A lot of work to maintain this type of thing, but we've got intelligent people. Everybody on the platform, very experienced, and so they grab the bull by the horns, make it happen. We just acquired a hospital in Hawaii, and boy, large and small animal, and the next island over is a 45-minute flight. So, and they're sort of doing on call, but not always. So it's these places need us, and it helps.
I think we have another question. Sheila, did you have a question?
Yeah. I was just wondering how much you pay your vets.
Yeah, so it depends somewhat on on the experience level and where we are with the company, because prices, of course, inflation, all that stuff changes stuff. But they do get paid based on cases that they see. So they get a percentage of whatever case comes of what the case comes in. So it's based on volume. And the reason why we base it on volume is because we know that on average our veterinarians are spending around 12 minutes per case. And so I want to make it where their hourly rate, even though they're getting paid per case, is decent enough for a wage for them. So they get paid per case they see, and then on the that's for the non-equine platform. On the equine platform, which houses only equine doctors for horse owners, they get paid a bit more because their cases take a little bit longer, about 20 minutes on average, and they deal with a lot more technical issues because the horse is not at home. They have to go into the field, the Wi-Fi cuts out, their cell phone dies, it's snowing out, wind, it's dark. So they deal with a lot more factors, so it takes them longer. And equine vets are harder to find. Horses are also a bit more expensive, and so they come with a bigger price tag. But they get paid per case they see. Yeah. It's important to note though too, because people think volume and think, oh well, then you must rush your doctors, And of course, if I could have every doctor take 5 minutes on a video, great. That's great for everybody. But that's not realistic, and you can't have veterinarians operate in a stressed out manner where the boss is watching them. And so I make sure it's clear that they can practice how they want to practice. If they are typically slower veterinarians, so be it. I'm not going to change your style. If you're faster, great. If you want advice for how to be faster, how to be more efficient on the platform without sacrificing quality, we can talk about it. Because my average is 6 to 8 minutes. That's my average. I'm the fastest doctor on the platform, and so I have techniques that I use to be that way. But not everybody is me, nor should they be. So if I have doctors that spend 45 minutes per case, that's fine. If they're happy with that, that's fine. I need doctors who enjoy this line of work. Doesn't matter what kind of money you make. If you don't enjoy the thing, you're not going to do it, and you won't be great at it either. Mistakes happen when you're rushing and all that. So we don't rush doctors. It just so happens the average time is about 10 to 12 minutes. That's just naturally the way it goes. So it's naturally kind of fast, but I don't rush doctors, even though they get paid based on every case they see.
I have another question. Kind of two in one.
Sure.
2 for 1. So do you have one veterinarian per location, or is it a radius? And then does that veterinarian have other veterinarians in that block to consult with, or how do you organize that?
So if you look at the current laws in the U.S. and outside the U.S., they will say something like, if you're performing telehealth in the event of an emergency, we will defer to the judgment of the veterinarian. And so because of that, because all of our cases are emergencies, to me, doesn't matter where the veterinarian is located geographically, as long as they're a licensed veterinarian and in good standing, they can see whatever case shows up, first come, first serve. So you could have a doctor in Washington triaging a client in Florida. You can have an American citizen who's traveling in Italy for vacation talking to a doctor in Wisconsin. And so that's what the beauty about globalization and virtual care comes into play. So it doesn't matter to me where they're located and where they're licensed. So in terms of the doctors having other doctors on, that's not the way it works. It's kind of like Uber more. It's more like that model where I have X number of doctors on any given time. Cases show up, they grab cases, doctors jump off, jump on, jump off. If we have more cases coming in than doctors on, we alert the doctors, we need more help, jump on, they start jumping. Our average wait time is 2 minutes for the clients. That's how efficient we are with getting doctors on board, because you can't have people wait too long. And anyway, that's how it operates. So think of it more like an Uber model. It's they sign up and then cases show up and then they sign off. And that's 24/7. And that's multiple doctors on any given hour, both equine and non-equine, and as well as English and Spanish speaking.
How many veterinarians do you have right now?
Roughly 60-ish. It fluctuates because some people, like I said, join us temporarily. Some folks all of a sudden have personal or professional things that come up that they can no longer work. And some take time off, or they're traveling or whatever. So about 60 doctors, give or take. I can easily double it. It's just I want to make sure that doctors I currently have are busy enough to make a formidable salary, so we're not causing congestion. So Yeah, and that includes Spanish speaking. It includes equine as well, because a lot of these doctors have multiple disciplinaries. You know, you have doctors who are not just Spanish speaking; they're bilinguals. They can see both English and Spanish speaking. And we have some equine doctors that are okay with non-equine cases, and so they'll overlap there too. So about 60-ish doctors, and then support staff about 6.
Thank you.
Yeah, thanks for all the questions.
I had a question. You
Yes.
said that you were set up in like around 20 countries or so. Are all your employees like from the US and can work in those countries, or do you have people set up in other countries?
Most of the associations we have with other countries are usually Americans that are traveling there with their pet, and then they get in trouble, and then they access us. We have some locals that'll use us from other countries, especially the Spanish-speaking population. But most of them are Americans that just are traveling with their pet, and then something happens. A lot of our veterinarians, most of them live in the U.S. They're licensed and they're trained and licensed, and they live in the U.S. However, we have a good number of explants. We have U.S. trained and licensed veterinarians that live elsewhere. So I've got doctors in Australia, Greece, Lebanon, New Zealand, South Africa, Canada. As long as they're licensed and in good standing, then I take them. I also, we have not necessarily an auditing system, but we do monitor at least early on the doctors just to make sure, because you can imagine if you're the first one doing something in a field, like you're taking this on, right? You want to try and improve stuff ethically, legally, etc. You need to make sure you're on point, and so we want to make sure we have quality control. Right? Not every veterinarian is good for this position. They just aren't. Some are really experienced and they suck at this. Others are fairly newer vets and they're great at this. And of course, there's technology too. Can my veterinarian type? Do they know how to like split a screen on a computer? Can they use a mouse? I mean, we have some doctors that are very, very experienced veterinarians. They barely touch a computer. So we need to make sure that all that stuff's up to par, and it includes the medical notes. You want to make sure that everything in there is clear. So my doctors have to have sufficient training and experience to be able to write a SOAP that is thorough as possible, even though you're seeing a pet on video. So not every doctor's cut out for this, and there have been doctors that have lived elsewhere that I've let go because just the training just isn't there. They just don't have it. And so yeah, I try to stick to doctors who are U.S. Trained and licensed. The U.S. schools are the best, you know. They just are top notch, and you can see it, you can tell. No offense to other schools, obviously they do great work, but in my opinion, tip top are the U.S. schools.
All right, well, probably should wrap up. I think these guys have class in what, three minutes? So thank you so much. This was super awesome.
Thank you. Thanks for having me. Anytime, I'm happy to come back, and feel free to reach out to me. I appreciate it, folks. Good luck in your careers.
I'll share the contact information with you guys so you have.